are the disease associated with long-term vaping? Could you please give some example?
So, I'm not sure they heard the term EVALI, which is basically e-cigarettes and the use of vaping on lung disease and stuff. Mainly it's caused from inflammation and onto the lungs, and this kind of inflammation causes long-term health deterioration. Um, we don't really have a specific, for example, a specific disease, but because we don't really fully understand it as of now yet, but there is a potential that it could cause more severe diseases like lung cancer. That is one of the potential outcome that could happen.
Vaping without nicotine is just the sweetness and some chemicals in the vape. Are they not harmful?
There's American research that's done which shows that when you use vaping, um, that we took lung samples from patients that vape and patients that are healthy, and there's something called vitamin E acetate, which I'm not sure whether you've heard of it. So it's one of the basically it's one of the things that was found that's different between the healthy patients and the patients that come in vaping with the inflammation, and that's one of the reasons why they think that that could be one of the chemicals that can be causing it. EVALI is more of inflammation from using the e-cigarettes, and it's normally thought to be related to vitamin E acetate, which I mentioned just now, that is seen in the vape chemicals and stuff. Um, the inflammation then leads on to have effects and makes the patients have cough and breathless and so on. Imagine a patient using vape. By the time they get a serious side effects, like for example the shortness of breath or EVALI, it might be years down the road. And by that time, we might be seeing them and looking at more of, oh, they come in with infection more than EVALI. Even though EVALI might be the main route, it might not be what the patient presented to hospital with.